I'm Dr. Joe Alaimo, and today I want to talk to you a little bit about gluten sensitivity and gluten sensitivity testing. The reason why this topic is so important is because in my office I treat a lot of chronically ill patients. These are patients with chronic conditions that have been suffering for a long time. Things like diabetes, Hashimoto's disease, hypothyroid, fibromyalgia, neuropathy, and a common link with a lot of these chronic conditions is gluten sensitivity. Now, what is gluten? Gluten is a protein that is found in wheat, rye, barley, and oats. And in our standard American diet, which is sad, we overeat these things, and because they become genetically modified and they get stored in big silos and they get pesticides, they get contaminated. Our bodies were not made to deal with this type of contamination, this type of a protein, and so our bodies have a difficult time breaking it down. So, gluten right now has been linked to 55 known diseases, including things like Alzheimer's, Parkinson's, multiple sclerosis, rheumatoid arthritis, ADD, brain fog, Hashimoto's, a lot of different conditions. And as you can see, what happens with gluten sensitivity typically is that if your body becomes sensitive to this protein, it's pulling on a chain in your body. And wherever your weak link is where your symptoms may develop. Now, the big misconception is that gluten sensitivity or celiac disease is primarily in the gut and that's all there is. And that's not really the end of the story. Celiac disease is an end stage of gluten sensitivity that manifests itself in the gut. Now, 80% of all gluten sensitivity is actually outside of the gut. So it's primarily a neurological disorder, meaning it'll affect your brain and your nerves more so than it affects your gut. So that's number one that we need to understand. Number two is, why is testing so arbitrary today, and how come more people don't get tested for it since it's linked to so many different known diseases, especially people that are not responding to other types of therapy? The reason is because the traditional healthcare approach towards evaluating this condition is what they look at is an enzyme called tissue transglutaminase antibody. Big fancy word, and it's a great blood test, 100% accurate and sensitive, and covered by your insurance. So it's a really good test. So why did I say it was a bad test? It's a bad test because it's only positive when you've had complete destruction done to the inside walls of your intestines. So let me show you what that looks like. This is your intestinal wall, and you have these different shags inside that intestinal wall. They're made to absorb nutrients. So this one may absorb calcium or phosphorus or vitamin K, whatever it is. They all absorb different things. And what happens when you have a gluten sensitivity is that these shags get worn down. So if they get worn down like that, and you go get checked because you don't feel good, and your doctor tests your tissue transglutaminase antibody, guess what? It's going to show up negative. So he's going to say you're not gluten sensitive, continue to eat gluten. So you will. And you'll go back a little while later, maybe 6 months or a year, as your condition deteriorates. They retest you. Now the villi look like this. A little bit more significant, but like I told you, that tissue transglutaminase antibody only shows up positive 100% of the time in overt villus atrophy. It has to be complete overt villus atrophy, meaning it has to be completely worn down. So now that test still comes up negative. You go back a year later, and now that we've had complete destruction of those villi, guess what? Now you'll have a positive tissue transglutaminase antibody, and the treatment for that is to go gluten-free. Now, our goal and our objective is to get patients before they get to this end stage. Remember, this is just an end stage of the disease. What we want to do is get patients before they develop this end stage and catch them in the earlier stages, because this can take 10, 20, 30 years to develop, and especially as it manifests in other tissues. So the testing that we utilize today is much more advanced, much more sophisticated than your regular blood test that your traditional healthcare providers will do. So if you think you're gluten sensitive, or if you're suffering with something that either they can't figure out or something that you just have to live with, then you need to give us a call and try to figure out, first of all, if you're gluten sensitive, and if you are, let's use the most sophisticated test to determine that, and then get you on a proper eating plan and protocol to help heal up your gut, heal up your brain, and get you healthy again. So if you need anything else, you can reach us at 910-251-1620, and I look forward to helping you recover. Thanks, and have a great day.